just in the event we have a crowd.
Good evening. Welcome to your City Commission study session and special meeting. Please turn off or silence all cell phones during the meeting. Today is Tuesday, September 15th, 2020. Meetings are televised every day on Channel 2 at 7 p.m. at midnight and available for viewing on YouTube and Facebook Live. In accordance with Kansas Open Meetings Act, the meeting can be viewed on Channel 2 and via Facebook Live. The Leavenworth City Commission meeting will be open to the public with limited seating capacity. To reserve a seat, email cwilliamson@firstcity.org no later than 4 p.m. on September 15th. Seats will be available on a first-come, first-served basis. To mitigate the spread of COVID-19, face coverings and social distancing are required to attend the meeting. The public is encouraged to continue to view the meeting via Facebook Live or Channel 2. Submit your comments or questions on agenda items to be read during discussion on that topic to cwilliamson@firstcity.org. No later than 6 p.m. on September 15th. For call-in options related to commenting on agenda items, submit your inquiry to cwilliamson@firstcity.org. I would ask everyone who's joining remotely to go on mute, please. We have 4 topics for today's study session, and then a special meeting which we'll have after those 4 topics. And so the first topic, I would like to welcome Ms. Paula Ellis, CEO of St. John Hospital, who will provide an update to the City Commission on St. John Hospital. Good evening, Ms. Ellis.
Well, good evening, and thank you so much for having me.
Well, thank you for joining us, and we're interested in hearing how St. John's Hospital is doing, and we may have a few questions at the end.
And that's perfectly fine. I thought I would just start by providing some information. I know that Sam Allred attended a meeting of the council earlier this year in my absence and provided some information, so I'm just updating that.
Yes.
Here are the statistics as of the last day of August of this year. We had our first COVID positive acute admission in March. And since that time, we have treated 31 COVID positive patients in the acute care setting and 116 persons under investigation. So those were people who came to us primarily through the emergency room. They had symptoms that were consistent with COVID-19 and required admission to the hospital. We treated them, but they turned out to be negative for COVID-19. All in all, we've tested 821, both inpatients and outpatients. Of those 821, we have had 57 COVID positive results, which is 6.9% positive rate. I want to jump to I want to jump over the senior behavioral health update and go to that next bullet point because it is not accurate. Someone else typed this and sent it, and that's fine. I appreciate the help. But it should say that we have been 100% screening all patients, employees, and outpatients since March 18th of this year.
Sure.
So that should say 3 of 18 rather than 8 of 18.
Sure.
Masks are always required everywhere on our campus unless you are alone in your office at 7 o'clock at night and there is no one else around, and then I don't have to have a mask on. Back to the senior behavioral health update, I think that's probably of great concern to the community. That is a large segment of our population. That's a 30-bed unit. A geropsychiatric unit. The patients are criteria for admission is they must be over the age of 55. The vast majority of them are in their 70s and 80s. So it is an elderly population, along with their mental health diagnosis, which are primarily dementia, different types of dementia, as well as depression, and then some exacerbations of long-term mental illness, schizophrenia, manic depressive. But they also have a number of medical issues, and we did have our first positive case on that unit, and we have struggled since that time, primarily because the vast majority of the patients who come to that unit have been living in long-term care facilities. So the vast majority of them have been living in nursing homes primarily. And you are well aware of the situations across the United States with COVID positive patients in nursing home settings. So it has been difficult. We require 2 negative COVID tests before we will accept an admission on that unit. Then after the patient has been admitted, we do our own test as well to confirm that within our parameters, the patient is still negative. And unfortunately, we have continued to find some positive patients being admitted to the unit. So I'm not saying that anyone was trying to be untruthful in any way about the testing. It's generally a timing issue. As you know, for the PCR test, that's the test that actually tests for the RNA of the virus. That's the nasopharyngeal swab. And for that test to test positive, the patient has to have enough viral load, or they have to have enough virus in their body in order to pick it up on the swab and then test for that, the ribonucleic acid of the virus. And so generally it's a matter of timing of the test. If the patient is early in their symptomology, they're not showing symptoms, they don't have a fever, they don't have a cough, they're not short of breath, and they're testing negative, and then a couple of days later, the viral load is higher, we're testing them, and they're testing positive. So consequently, we have closed our senior behavioral health unit to admissions 3 times since March. But we would much rather err on the side of safety than take a chance. And so we've had to do that. We hate it because we know that's a very important service to the community. But we've had to do that. And I must tell you that we have worked very closely with the Leavenworth County Health Department throughout this pandemic, and they have been nothing but incredibly supportive. They give great advice, great suggestions. They've just been with us 100% of the way as we have worked through the varying issues that we've encountered. Along with that update, I also want to let you know that we have kept the hospital close to admission, close to visitation. And we hate doing that. We know that it's tough on everyone, but we have to think of the fact that we really do treat a very vulnerable elderly population, not only on the senior behavioral health unit, but on our acute unit as well. If I read off the ages of our patients today, they're all in their late 70s and 80s. So we just want to protect them. We understand that it's important for them to connect with their family, connect with their loved ones. For those who wish to do so, we've been using a lot of FaceTime. The nurses are helping the patients. We have various protected devices so that the patients can talk to their families on FaceTime and connect in that way. But we are having no visitors to the hospital. And we have been very fortunate in that we have never had a shortage of the personal protective equipment, gowns, gloves, masks, face shields. We've never had a shortage of them. We've been incredibly fortunate throughout this entire pandemic. So I am certainly open to questions and would welcome the opportunity to try to answer them.
Any questions from commissioners?
I'm sorry, I didn't hear that.
No, I was just asking my fellow commissioners if any of them have questions for you, Ms. Ellis.
Oh, thank you.
Commissioner Leonhard, Ms. Ellis, I know since Cushing St. Luke's has shut down and St. John Hospital has gotten quite a bit busier and staff's working really hard, especially in outpatient surgery, outpatient services. Do you find maybe in the future you will get an MRI machine?
We have been discussing that with our corporate office actually for the last several months prior to knowing anything. Well, we had the original changes in the model of Cushing last year about this time, and we began those discussions then. We're still in those discussions. You know, the cost of the machine is really not the issue. It's figuring out where to put it. And we're, strangely enough, you know, we're tighter on space than we'd like to be. So, but we're, yes, those are active discussions. Thank you for asking.
Okay, thank you.
On that note, I might share with the group that in August we had the highest number of ED visits that we have had for well over a year. We had 1,021 ED visits in August. And so clearly during the initial months of the pandemic, people were staying away from the ED. They were staying away from the hospital, staying away from even physician visits. We shut down all elective procedures, not only surgeries, but elective radiology procedures and the like. So we had some low months, but without a doubt have definitely been coming back. Might also share with you that we have been fortunate to be able to hire a fair number of Cushing employees that wanted to stay in the area.
Good.
So we feel fortunate about that as well.
Thank you. That's a very important point, and I'm very happy to hear that. When you say ED, are you talking the emergency department?
I am.
Okay. Yeah, I thought I usually refer to it as the ER, but I understand ED. So that's good. Commissioner Preisinger, did you have a question?
Ms. Ellis, there are things that are going on in social media. I don't know that it's a rumor or whatever, but some people are saying, or there's statements out there saying hospitals will classify everyone as a COVID patient, or more than actually there are, since the government will pay them extra money if they have a COVID patient. Can you dispel that rumor or give some kind of credence to that rumor?
I absolutely can, because that is considered Medicare and fraud. You cannot diagnose a patient for something for which they do not have the symptoms of, the lab test to support, the physical findings to support, and that would be out and out fraud. And I don't know about you, the last thing I want to do is run afoul of the Office of the Inspector General, because they have the ability to take my license, any physician's license, the license of a hospital. So anyone who would think of doing such a thing, which I'm not saying that there probably aren't those kinds of minds out there, but that would be fraud in the first degree and against the Centers for Medicare and Medicaid. And I can't imagine anyone in their right mind wanting to do such a thing.
Okay, thank you. So, in your professional opinion, that just has no validity at all. Is that correct?
I can't imagine that would have any validity at all.
Okay, thank you.
Commissioner Bowder?
Yeah, I appreciate the fact that I know it's been tough with Cushing closing, and I'm glad to see that St. John is thriving. And do you see yourself adding any other additional services once Cushing actually closes for good?
You know, we are poised to add whatever services it would make sense for the people of this area to have. One of the things that we are actively doing is speaking to a number of specialists. You probably know that we have good family medicine here in town, and we have some of the Providence Medical Group specialists such as cardiology, orthopedic surgery, general surgery, OB. We also have ENT, and we've been fortunate that Dr. Reichschneider has joined us and is doing cataracts here. But we see that as very important to just grow that group of physicians because, again, when you look at the age of our population and the folks who need the services the most, it doesn't make sense that they should drive outside of the county to receive their services. And we want to be able to provide those services here in Leavenworth to people.
That's great. I agree completely with that. Thank you so much.
Well, thank you for the question.
Commissioner Wilson, do you have anything?
Besides the COVID-19, what other challenges are you all facing right now?
You know, we are so fortunate in that having the infrastructure of Prime, who is our owners, has been, that really has breathed the life into this hospital that wasn't there prior to 2013 when Prime purchased the hospital. One of the things, the first thing that they did, and I wasn't here, I did not come until 2016, but I can certainly attest to the fact that unfortunately, under the previous sponsorship of the sisters, they were not contributing anything to the infrastructure of the actual facility. There was just a number of things that needed to be fixed, replaced, remodeled, updated, you name it. So we've done everything from new windows to point tugging to, again, just recently, the old convent, and I'm sure there's a right term for this, but the term that I use as a country girl is we mud jacked it. It was literally, it was falling down. It was like a foot lower than it needed to be in the north part of the hospital where the sisters lived at one time. So our old convent area. So we got that completely jacked up to where it needed to be, got the walls and the floor all fixed again. So those were the kinds of things that need to be done. Anybody who has a building that was built in 1964 knows that there are things that constantly need to be done. But I'm so pleased that Prime takes the interest in the employees, well, the patients first, the employees second. Obviously, the equipment, they've updated all our CT scanners, literally all of our nuclear med cameras, all of our equipment has been new since 2013. And but you cannot deny things like chillers and plumbing and all kinds of systems that just constantly are in need of updating and repair, because the building was built in 1964.
Thank you.
Thank you.
Ms. Ellis, I have, this is Mayor Griswold, I have one question and then one comment. On the senior behavioral health unit, you said you've had to close it 3 times. When that happens, do all the patients in there, do they have to leave the hospital? Or do they stay there?
We simply closed it to admission.
Okay.
So we continued to take care of all the patients that were there until they could be safely discharged. But we simply closed it to admissions because we did not want to potentially take a risk of
Sure.
harming a patient
Sure.
from the outside. So that's how we handled that.
Good, thank you. I thought that would be your answer, but I just wanted to make sure. Do any of my fellow commissioners have any other questions for Ms. Ellis? Ms. Ellis, I want to thank you for coming this evening and giving us a very interesting and informative update on St. John Hospital, one of the crown jewels of the city of Leavenworth and our community. And would you please pass along on behalf of the entire city commission to your medical staff, all the people on your medical staff, our thanks and our appreciation for everything that's been done over the last 6 or 7 months. It's been very, very challenging, but they have stepped up, and we couldn't be prouder of you and the staff in St. John Hospital. So if you would pass that along from the city commission, I would appreciate it.
Thank you so much for those kind words.
Okay, thank you very much, and you have a good rest of your evening.
I will do so. Thank you.
Take care.
Bye-bye.
Bye. Next is a Catholic Charities update.
Yeah, Mr. Mayor and Commission, I'm going to turn this over in just a minute to a representative from Catholic Charities. I just wanted to have somebody come today and speak to the commission and the public about rent and utility assistance, some funds that the city has been fortunate enough to be able to pass along from the Community Development Block Grant, and the commission has been generous with bestowing on that organization to let you know what they've been doing, what the need is in the community, and what they can foresee upcoming about future needs. So I'm going to turn it over to Jackie from Catholic Charities and let her sort of walk you through that.
Good evening. Thank you so much for letting me come. First off, I want to talk to you about the money that we've expended here in the city of Leavenworth. As you know, your quick action back in, I think April, when we got the housing trust funds, that was the first COVID funding that came into this office. So you guys were right on it. Out of the $35,000, at this point, we have $9,200 left in that fund, okay? Water was the same way. They jumped right in. They provided $10,000 with their grant. We have less than $2,000 left in that fund, okay? Mm-hmm. CDBG, when it finally came through, now this is COVID money, but it didn't come in until July, okay? And that grant was like $30,000, okay? And there's $8,000 left there, okay? The other fund that we've got was EFSP, which was COVID money, and those funds are all expended at this point. Here in the city of Leavenworth, so far, we have expended like $61,900 just on COVID money, okay? So that's the amount of people that we're seeing. We're seeing people that that have COVID, that have also felt the financial impact of COVID. That's a big part of ours. Okay. Again, like I said, the funds that have come in, I do know we're supposed to be getting some emergency solutions grant funding that's supposed to be coming in fairly quickly. That's designated just for COVID as well. There's supposed to be some training coming up on that. But these are the funds that were just expended here for the city of Leavenworth. This is not the county.
Sure. Mm-hmm. That's a good rundown. Mr. Kramer, did you have something? Or?
Yeah, just a couple. Could you give us some examples of where the majority of that money goes? Are you seeing some new people in the community that you haven't seen before? And then what are some of the challenges that you see maybe over the next 3 to 6 months? Are they the same ones and you just need more money? Or are they going to be new challenges as this evolves?
Okay, we are seeing a lot of new people that have not been faced with this type of situation before, okay? I'm gonna say the majority of it, has come into play with rent. And then we're also seeing high utility bills. And the reason for that is, a lot of people are on a pay plan. You're not able to make the pay plan. The whole bill comes due. They don't want to put you back on a pay plan because you didn't keep the first one. And so all of a sudden, we're seeing people that have got a $1,600 electric bill. Okay? You know, like I said, the whole bill came due, they lost their job, there's nothing there to pay it. Fortunately, with how the utility companies were handling that, they had put off disconnections, the landlords weren't able to file for evictions. All of that has helped, okay? Because at least it allows us time to get in and work with them. What's the plan? What are we doing moving forward? That kind of situation, okay? People that, like I said, we have new people that have not been in this situation before and have always managed just fine, but this is new for them. This is new for them. Did I answer all of that, or did I miss anything?
No, I think you did. One other question I had, having worked with Catholic Charities a little bit in my role, I know you had some rules on how often people could use these rent and utility assistance. Are you flexible with those rules? Have you had to adapt those rules?
With those rules at this time.
I'm sorry, I think I was talking over you. What did you say?
We are more flexible with those rules at this time. You know, the rules have kind of gone out the window. Nobody was expecting this pandemic. Okay. And normally, like and even with the EFSP funds that we have expended, like when you use those funds, that's just 1 month's rent. Okay. What we've been seeing is people that are like 3 months behind. Okay. And it doesn't do you, if they're still in crisis, you're not doing what we need to be doing. We need to be getting them out of crisis, making sure that they're going to be able to maintain moving forward and stabilizing the household.
Jackie, one more real quick one for you. I know there's some commissioners with some questions. The city has some, we just heard today that we have some new CDBG dollars coming in. We also have some CARES Act funds potentially coming in. What will those funds help your organization and other nonprofits do over the next 6 months or so?
Okay, I don't see this ending anytime real soon, okay? At this point, like I said, almost $70,000 or $62,000 that we've expended has just been here in Leavenworth. That's just the city of Leavenworth. That's not what we've spent out in the county. Okay, I think we're going to, even people that have returned to work, you know, some of them aren't working full time yet. So their hours, what they were pre-COVID, is not back up to where they were at that point before COVID hit. Okay, so even the businesses that are opening back up, we're still seeing the reduction in the income. So, yeah, like I said, I don't see this coming back real quick. And I think we're gonna have people that have, we still have people out there that have been impacted, that have been able to use their savings, their stimulus, and have managed just fine. They're going to start to run out of those. We're going to see more of those.
Thank you, Mr. Kramer. Are there any questions, Commissioner Bowder?
Yeah, thank you, Jackie, for coming. I really appreciate you being here. Jackie didn't mention the fact that it's not only just giving out money for rent, but they provide so many more services in regard to budgeting. Do you want to touch on that real quick? And also, just the fact that it's an ongoing problem. These are not, I mean, I get calls at United Way every day, and they're new problems. People who've been able to work for a while, but now they're starting to lay off, and they're getting laid off, and and they're getting part-time work, but it's just not enough. You want to touch on a couple of those things and your other services?
Okay, yeah, through Catholic Charities, we offer, in addition to that, we of course do the food pantry. Right now, we have been a client choice food pantry. We have not been able to do that with COVID. For everybody's safety, we're handing out food at this point. We have opened up our clothes closet again. We just had so many people and so many requests. We are limiting that to one person at a time. Everybody here has to be in a mask, okay? And we have the the sanitizer as they come in, okay, so they can take care of their hands and whatever. When they come in, we do go through budgeting and financial information with them. We also offer financial classes that they can take online, okay? There is a ongoing program that we've kind of just started, financial family transformations, and we're trying to sign people up for that on how to better manage money, and it's a more intense program.
Thank you. Commissioner Wilson or Commissioner Leonhardt, any questions for Ms. Masoner?
Yes, Commissioner Wilson, when applying for financial assistance, what's the process and how long does it take before you're able to get the assistance?
Okay, when somebody comes into us, we have them make an appointment, and then that way they know everything to bring. So we're not being held up. Most of the time, if they've got everything, like say I've got to do a utility bill, I can normally get that utility bill taken care of that afternoon or that day, okay? Rent, there's a form that we normally require their landlord to fill out, guaranteeing the participant 30 days additional occupancy. When they sign that and they agree to take our money, it's clearly stated on there that for 30 days, you're going to allow this person to remain on this property, okay? And that is part of our paperwork, and it's with any of our programs, that's a must. So that tends to slow down the process a little bit for rent, okay? And I'm always very clear with our landlords. Fortunately, in this crisis, I will say that we've actually had some awesome landlords. We have talked to some of the apartment complexes. Some of the landlords know that we have this funding. They refer their people over here. I took one today, and she's like, well, I talked to my landlord, and I'm like, I don't know how I'm going to pay you. And she had worked for the school district. So she was drawing unemployment, okay? And now then the school district's opened back up, but the children her kids are 2 days in school, and then the other days at home. And with the ages, she can't go back. Okay, you can't leave little kids at home. And with the money she would make, childcare on the younger ones, she wouldn't make any money. There's just no way. And she's like, I don't know what I'm going to do. And he's like, you're going to call Jackie. So that was my one today, okay? Mm-hmm. She called here, and we got her in, and the landlord even made a special trip over here to drop off that paperwork. Yeah, because he was trying to help her out. So it's been awesome. I will say the landlords in Leavenworth have really been awesome. They have emailed me, I'm sending this person. So yeah, they've been trying to assist their people that they know have been affected by COVID and getting them the help that they need.
Good.
And working with us.
Good. Commissioner Leonhardt, do you have a question?
I do. Hi, Jackie. Thanks for joining us and give us the information. I know it's a challenging time, of course. You're servicing more people for the food pantry. What do you find that you are having a shortage of on food? Is it just in general or?
Right now, the things that we typically run out of are, like, believe it or not, toilet paper, fruit, canned fruit, we can't keep that, and kind of the canned meat, tuna, canned chicken, yeah, and cereal. Those are the items that we mostly run out of, Camilla.
Okay, and then what if people wanted to donate, just to say what your hours are, maybe they can.
Okay, the hours, we normally have the doors unlocked during our food pantry hours, and how the food pantry works, we open that up at 9 o'clock. It's from 9 to 11:30. And if they come up right at 11:30, then that still gives us time to get them taken care of. And we've actually set that up during, when we were having people come in, and that would allow us plenty of time to get them through comfortably before the noon lunch hour, okay? And I thought, I don't want to confuse people and have hours going back and forth and changing and everything. So we have just left it at 11:30, and then we open again from 1 until 3:30, again with the idea that if they were coming through shopping and they showed up right at 3:30, it's not a rush to get them out the door at 5:04. But we are actually here, like I'm here till 4:30. I'm actually here before 8. So yeah, we're here and taking care of stuff and answering phone calls and setting up and running down stuff. So if we know something's coming in, we'll make arrangements for that and be ready to accept it up until 4:30.
Okay, and that's Monday through Friday, correct?
Monday through Friday. Now, the food pantry is not open on Fridays, but we are here working.
Okay, thank you, Jackie.
All right.
Commissioner Preisinger, do you have any questions?
Just to follow up to Commissioner Leonard's, can you, for people that are listening, give the address of your location on North 5th so people know where to make the donations if they choose to?
Yeah, we're 716 North 5th Street.
Okay, and people can make donations of clothes and obviously food, as you talked about earlier, but clothing is welcome too? Good, used, clean clothing? I'm sorry?
Right now, we are not accepting clothing.
Okay.
And the reason for that is, as soon as the COVID thing passed, well, everybody was off from work, so everybody in the free world got their closet cleaned out, with the exception of me.
Okay. Okay.
And what happened is, the amount of donations that we got, because everybody had this wonderful opportunity, was
Overwhelming.
staggering.
Yeah. Okay, so
We're still
food.
trying to organize the basement and we're handing it out as fast as we can, but we've got an abundance. And I don't think we're the only ones, because I think that there was a couple other agencies in town, and they're like, oh yeah, it's been really generous at this point.
Okay, thank
Like
you.
I said, I'm just jealous of all them people that had time to clean out their closet.
And so the address again, 716 North 5th?
Yes.
Okay, right, I know where it is, but for all those that are listening, 716 North 5th. Thank you.
Any other
Thank you.
questions or comments from my fellow commissioners? I've got a couple of comments. First of all, thank you, Ms. Masoner, for coming tonight and giving us a very informative and thorough rundown in terms of Catholic Charities and everything you continue to do, and do it even, at a higher level over the last 5 or 6 months. We really appreciate and value all the services and the care that you have for the citizens in the community. So thank you, and please pass along to your Catholic Charities staff the appreciation of all the city commissioners, if you would do that, please.
I will.
And then I did appreciate the information and kind of the feedback on the landlords. Most of our landlords, according to Ms. Masoner, are doing the right thing and stepping up, and I thank them too. That's very, very important, and I respect that, and I think the world that most of them are doing that and making it a little bit easier on many of our citizens who are facing the consequences of the economic effects of COVID-19.
Yes.
So thank you very much, and you have a good rest of your week.
All right, thank you
Thank
so
you.
much for allowing me to come. Bye,
Okay.
guys.
Thank you. We are going to go to the third item on the agenda, and this is a 2020 public safety update. And don't believe, Chief Kitchens, our police chief, is here to speak to the city commission, so I'll turn it over to him.
Mr. Mayor and Commission, thank you very much for allowing me to come this evening and give sort of a brief overview, snapshot of a public safety report. I'd like to begin, if I might, with a little bit of an update or sort of a progress report, if you will, on our use of force project that we've undergone. As a brief reminder, the police department held 2 separate community conversations on police use of force over the summer. One was held on July 13th at the Riverfront Community Center. The other one was held on August the 8th at St. Mary University. The very first one we recorded and played repeatedly on Channel 2 for a period of time. It was well attended. There was also a couple of people there that did some Facebook Live stuff, and there were several thousand people that saw it. We had a conversation about a variety of topics associated with use of force, constitutional language, Supreme Court cases, Kansas state law, department policy, and that sort of thing. I thought the best part of it was afterwards, the interaction. We had some officers attend and hang out for probably a half hour or so and have some personal conversations with people. I thought that was incredibly helpful for both sides of the conversation. Going forward from that, we did some policy discussions at the police department. We're generally in line with policies regarding use of force with most agencies in the United States. Again, as a reminder, we use the IACP model program. We did a top-to-bottom review of our department's policies that govern use of force. We also took a lot of notes at the public forums, and then we were paying particular attention over the last few months of the national conversation that's going on about police use of force in the event that we heard something that we might think about adopting here in our community. And so I've been very busy relative to that. My findings are not concluded, but I'm generally comfortable, with one exception, with our department's policies that we have that govern use of force. I'm comfortable with the use of force tools that we have available for the officers, which are pretty wide-ranging. I'm comfortable with our use of force review process. The principal part of that is the body camera program that we have. It gives us an opportunity to look at every single encounter and make some determination about the use of force that our officers are engaged in. And I'm also comfortable with our training curriculum. The state of Kansas mandates a total of 40 hours for each officer to get recertified. However, our target here in Leavenworth is 75 hours. And by and large, most officers meet that target goal of 75 hours. And a lot of that has to do with use of force, de-escalation, verbal judo, those things that would help the officer be successful in managing a particular incident. The one issue that we are conducting a review of regarding policy is a duty to intervene policy. It is our assessment that it is probably inherent in our policy that there's a duty to intervene, but it is not clearly spelled out. And so we found some language that we're reviewing right now that I would anticipate being adopted as part of our policies moving forward. I'll read some of that. An officer present and observing another officer using force that's clearly beyond that which is objectively reasonable under the circumstances shall, when in a position to do so, intercede to prevent the use of unreasonable force. An officer who observes another officer use force that exceeds the degree of force permitted by law should promptly report those observations to a supervisor. That's the best sample language that we found in the last 60 days or so. I'm an advocate of policy changes being very slow and methodical. I don't like to make snap decisions. What I have to do is I have to understand what it is I have to be able to communicate and teach what the policy is designed to do. We have to train on it, and then we have to be prepared to answer questions from the officers about a variety of scenarios they might encounter and how this policy might impact those decisions. And so we're coming to closure on that. Very likely in the next month or so or two, we will probably adopt something like this or very similar to this use of force policy, to enhance what we currently have. So that's kind of a progress report on what we have been doing over the course of the last 60 or 90 days relative to that. I kind of introduced a little bit of a break in the event that the commissioners wanted to talk about this before we move over to discussions about the crime issue. So, Mr. Mayor.
On the certification you talked about, the requirement from the state of Kansas of 40 versus 75 hours for your police officers. Is that on an annual basis, or is that just a recertification every 3 or 4 years? What time period are we talking about for those 75 hours?
So the state law in Kansas requires 40 hours per year for you to get recertified as a police officer. The 75-hour policy is internal to our police department. That's sort of a target that we try and do above and beyond the 40 hours. But the minimum is 40. Now, over the course of the last year, they did provide some exceptions because of COVID. A lot of things were shut down, so they allowed some exceptions from the 40-hour provision. But by and large, I think most of our officers met the 40-hour requirement.
But that requirement for certification, that is an annual requirement for our police officers?
Yes, sir.
And is some of that training online, or most of it online, or just
right.
What's it like?
There are specific provisions in the regulations on how that works. Only some of it can be online. Off the top of my head, I think it's only 20 of the hours can be online. The other 20 hours are required to be in person. What we try and do, as part of that routine is we try and do about 80% of it sort of internal to the police department. But we try and get the officers out of the agency to other outside entities so that they can get different information, different instructor certification levels outside of what we do internally. Some of it is regulated very heavily. For example, like CPR and AED and hazardous material. There are a list of things that we're required to do, and that's laid out pretty clearly. And then we have some flexibility beyond that to try and ensure that we're meeting the range of responsibilities for training.
Yeah, this is 75 hours is a lot of hours, but that's good. But it sounds like you have some innovative ways to make sure that the officers do receive the training that they need, and that is required to be certified. I just didn't realize, and it's good, that police officers had to be certified every year.
Right. That's different from various states. Yeah. I'll be honest with you, Kansas is pretty high on the list of training requirements. We're pretty far up there.
Okay, Commissioner Bowder, did you have a question?
Yeah, I just had a quick question here on this wording, I guess it is. An officer who observes another officer use force that exceeds a degree of force permitted by law should promptly report these. They are the law, so it's like if they're not following the law, then shouldn't that be must instead of should?
So I think that so I think what the language is designed to say, whether it does that properly, it says if you go above what you're allowed to do, then the other officer is required to.
Required to. Okay, I understand that. But you said should report. I think it should be required, but it just says should. I just wondered about the wording. That's all. Right.
The other parts of our policy require absolute reporting on all incidents of use of force. Each officer has to do an individual report about what they did or what they saw. The second sentence in here is sort of secondary to the first part, which is the duty to intervene, I think is.
That's what's a little confusing, I think.
Right. And so we'll work on that to try and clear that up.
Right. Any other commissioners have any comments or questions for Chief Kitchens? No, let's go on to the next part of your report, Chief.
So I want to also provide some sort of update and snapshot of crime in our community. In April of every year, we issue a very thorough report that goes very, very deep into statistics and crime rates and all of those sorts of things. And so this is not at that level. We'll certainly do that in April, but we are sort of, August kind of concludes the summertime for us really, which really is probably the busiest time of year for the law enforcement. That's generally associated everywhere. And so as we get to the end of August, we get to the end of summer, we kind of take a quick snapshot, kind of a look at how things have gone so far this year. And I'd like to talk about two things in particular that have drawn our attention. One of which is gun violence. I'll talk about gun violence in our community, and then the other big issue that we've been dealing a lot with is stolen automobiles. Those are two things that are sort of jumping off the table at us as we look at it. Let's start with gun violence. Over the course of the last several months, we've had terrible tragedy involving two murders, one of which took place in the middle of July on 13th Street Terrace. It took us a couple of months, but we have been able to identify and seek and get criminal charges on the perpetrator of that crime. I have in quotations Operation Legend. The person that we were looking for was hiding in Lee Summit, Missouri. And so I called the U.S. Marshal Ron Miller from our area and asked him for assistance. They happened to have Operation Legend going on in the Kansas City metropolitan area. There were several hundred federal agents, and so they facilitated helping us apprehend the suspect. They got on it right away, and in a matter of about 24 hours, he was apprehended. And quite frankly, he turned himself in because he heard that the marshals were looking for him. And so that was very helpful to us in that regard. The second one happened, I think, most recently out on Eisenhower Road. A person was shot and killed as a result of a disturbance that actually started in the city of Lansing at the bar there and happened to be on Eisenhower Road in our community. And so we're working on that, making substantial progress in that case. We're not near an arrest or anything like that, but I'm satisfied that the investigation is progressing. In addition to those two separate incidents, we've responded to a series of shootings in the Woodland Village apartment complex. The principal obstacle for us in that regard is cooperation from the victims. That's not uncommon, culturally speaking. It's easy to surmise that when that happens and the victim doesn't want to cooperate with it, there's probably some behavior that was illegal going on that they don't want discovered as well. And so, respective to that, there have been over from the early part of the summer through up until now 7 incidents that were pretty serious down there. 3 of those were associated with one particular apartment and one particular person. I'm happy to report that we have identified the suspects and perpetrators in 2 of the 3 of those incidents and referred those to Mr. Thompson's office for charges, and so we'll hopefully that'll resolve itself relatively soon. The property management company down there's been a little bit of turnover, so there was the new owners of the property and they hired some property management companies, and that's changed a little bit, but they are helping. They've taken steps, for example, in that instance to move through the process of evicting that particular person, which is the source of the shootings, and so that's helpful. The technology down there has taken a pretty significant upgrade. The officers on their iPhones, if something happens down there and someone calls 911, they can pull up the cameras on their cell phones while they're responding and see what's happening while they're going, instead of having to wait to get there to find out. That helps us with people that are fleeing. We can get information about suspects and cars and that sort of thing. So even if we get there afterwards, we'll have really good information. And so that has been incredibly helpful in helping us overcome, reluctant witnesses and cooperation and that sort of thing. And so that's been very, very helpful. We are making progress relative to that particular issue with the investigations and that sort of thing. But again, culturally speaking, there's just, and that's been around for a very long time, some reluctance from victims who have been, the subject of gun violence to cooperate with the police. So that's kind of where we are with the gun violence issue. In addition to that, what's also jumping off the table at us is stolen automobiles. We have had 115 stolen automobiles in the first 8 months of the year, which is well above our average. I think we were at something like 80 last year at this time. This is my call to remind people to help us help you by locking your car, Don't leave your keys in the car either. That's also a significant contributing factor. I know it's innocent. I know people are busy and mindful of other things, but this is something that we can, communicate to the public that if they will help themselves, it will be better for everybody. Generally, a stolen automobile is a crime of opportunity more than anything. If they are out looking for stolen cars, if they find one that's unlocked, it's just much easier to do that. So I would just ask people to be a little bit more mindful of that so that we can help them, if that makes sense.
Could we, is that it on the stolen cars and the gun violence?
Yes.
I'm gonna ask the commissioners if they have any questions
Sure.
for these two topics. Commissioners, any questions for Chief Kitchens on gun violence or stolen autos?
Commissioner Leonhard?
Uh,
Okay, of those 115 stolen cars, how many of those do you recover, or even when you recover them, are they like totaled or?
Most of them we recover, and by we, I mean law enforcement. So for example, it is not uncommon for a car to be stolen here and then recovered in, say, Lawrence or Kansas City or Atchison or something like that. More often than not, they're not damaged unless there's some, chase with the police or something in a different jurisdiction. We do recover most of them. It's mostly being stolen to get from point A to point B, or the circumstances in which we don't recover them. Typically, they're traded for stolen guns or drugs or somewhere else in a different community, and so that's something that we chase quite frequently. But I would suggest to you a lot of them are recovered sufficiently to give back to the owner.
Okay, thank you, Chief Kitchens.
Yes, ma'am.
Commissioner Wilson?
Yes, Chief, got a question pertaining to Woodland Village. Did they say when or have a time frame specifically of when they will be putting security back out there?
So for a very short period of time, they had a security guard out in the afternoon and the evening time hours. That is quite a costly endeavor for the property manager, and so I think that's probably guiding that decision more than anything. But I have not heard an update about if they are going to do that. We're doing our level best to be out there as much as we can be out there when we're not on calls for service to try and sort of deter some of that. But I have not gotten an update as to, if they intend to do that as a permanent part of the process.
And I don't know if you have the numbers in front of you, but how many incidents occurred with gun violence this year?
So it depends on sort of how you couch that, right? There's kind of three different things that happen. One of which is gunfire, where people are shooting their guns off, right? There's also instances where cars have been shot, but not a person. There's been an incident where apartments have been shot, where it's like a drive-by where they're shooting at a particular apartment. Those three that we had that were all associated with the same person, that was probably related to that. And then an unfortunate circumstance where we've had people actually shot. So I would say, as I sort of went through it, we've had 7 of those over the last few months that are very serious, where apartments are being shot, cars are being shot, or a person being shot. We've had many more instances of gunfire, but that's not necessarily just in Woodland Village. There are other parts of the community that have that as well. I can get you whatever number specifically you would like. If you want to email me or something, I can certainly get you more specific stuff about that. Just off the top of my head, that's kind of what we identified for this report.
Chief?
And one last question. Crime increasing not just in our community, but also in surrounding areas too as well, correct?
So the FBI today, or in the last 24 hours, have released their FBI crime index. And violent crime is going down. Crime in our community, the last time we did a really big statistical analysis, went down by the 11%. If you recall, sort of earlier in the year, it went down. So if I get to the final part of the report, I can kind of talk a little bit about numbers and where they are relative to where we are right now compared to last year without the calculation of COVID in the mix. Maybe that might be able to help.
That's good.
Got your Chief, appreciate it, thanks.
Yes, sir.
Commissioner Bowder, did you have a question? Commissioner Freisinger?
Chief, on stolen cars, I know it happens all over the city, but does it happen more in someone's driveway or like a Walmart parking lot, grocery store parking lot? Where is there a
Right, most
particular-
often it's overnight, okay?
Okay.
And cars being open, some occasions of the cars being left on, much more certainly than a car being stolen out of Walmart or something like that.
Okay.
That's generally where it is, at someone's house or parked on the street,
Okay.
something like that.
Okay, thank you.
Chief, go ahead. I think drug cases update is your next piece.
Yes, sir. So we always are working very hard on that. It's no secret that gun violence very often is associated with drug sales and drug environment. That's certainly part of the first murder that I talked about. For those of you who might have read the newspaper, I think the young man made his first appearance in court today. His picture was in the paper, and so there was some information about that. So the police department initiated a total of 75 drug cases so far this year in 2020. That is arrests where an officer had, say, done a traffic stop on somebody and found them in possession of methamphetamine or something like that when they arrested them. That is things like undercover operations, confidential informant operations, physical surveillance, electronic surveillance, all of those kinds of things that you might imagine a police department would do to try and apprehend people that are either in possession of illegal drugs or selling illegal drugs. We're very, very heavily involved in. And in addition to that, we have cooperative efforts with our local partners like the Sheriff's Department and our federal partners as well. Working very hard on that to try and combat that with the idea that if you attack that particular part of it, you can hopefully reduce the gun violence part as well. And then our resources are mostly devoted to heroin, methamphetamine, and prescription pills. That's what we spend a great deal of our time on, trying to combat and successfully arrest and prosecute people for drug cases. Okay?
Thank you.
And then as we move forward to sort of some other metrics, as we take a quick snapshot, calls for service, we're at a little bit more than 14,000 so far. So we're about 1,100 down from last year. And so I'm trying to calculate the COVID impact of that. We didn't stop taking calls for service. We just handled them slightly differently. So for example, somebody called in a minor crime that happened the day before. We might take that report over the telephone to limit the exposure of both the public and the officer to each other to sort of impact to try and participate in the impact. And so I'll keep an eye on that. Traffic citations are down a little bit as well, but keep in mind from March, April, and May, we really put the clamps on what we were out there doing to protect the public and protect the officers. We were still out there, but my guidance was it had to really be serious before them to affect the traffic stop, which they did, but certainly nothing that was minor in impact. And then we have a little over 400 domestic violence cases. Those are just something we have to deal with. We have to go and we have to make an arrest and we have to kind of figure that out. And so generally what I think I see is that the numbers are down right now from where they were at this time last year, but I'll take a quick look at that when we get to our bigger report in April.
Chief, has the traffic unit maybe not ramped back up to where we were last year at this time, but have they ramped back up from the March through May
Yeah, we're
timeframe?
slowly going back to full capacity. Quite honestly, it was actually a little bit of a benefit by this regard. So the traffic officers had to go to 2 weeks of advanced traffic investigation school, so they were out of service doing the training class for that. Okay. And then they went to another week of car seat installation class. So in this time, 4.5 days of how to install car seats.
Then how do you expect the common person to install one?
By calling us and having us help you. They were less than thrilled about day 3 with that because it gets a little tedious. But 4.5 days to get certified on how to properly install the variety of car seats that exist in the world, from booster seats and seat belts and all that. Right. Yeah, they're still not.
Is that training given by the state?
Yes, sir. Yeah, the Kansas Traffic Safety Office. Yes, sir. And so what we'll be able to do is when people are calling and say, hey, I'm a new parents, or,
Oh, yeah.
that we can help them with that, make sure it gets put in properly. So, and then don't ever take it out, because it's terribly difficult to get back in. So with that, I can talk a little bit about a COVID impact from the police department.
Go ahead.
It's been problematic at times for staffing, but we've managed to get through that. We had one officer that tested positive, was symptomatic and terribly sick. He was at home for the full 2-week quarantine of 14 days, but he was really, really sick. He managed to recover, thankfully, and he's back on full duty. We did have one officer test positive, but was asymptomatic, still required a 14-day quarantine. And then we've had 10 officers exposed while on duty calls over the course of the last few months that required quarantine and testing. Fortunately, those were negative. And then very early on, when it started, I would want to tell you sort of maybe late March, April, the public health department started testing public safety staff, fire department. They tested a total of 75, and we provided 5 randoms, and those folks were all negative. So we've had some impact. And then as soon as I said that, I jinxed myself because I have a detective that's quarantined, waiting testing results. That happened yesterday. And so I imagine that's our life as we move forward. Again, I would describe it as problematic for the police department, but nothing that has reduced it to the point where we couldn't go to calls and that sort of thing. We've been able to manage that. So that's kind of a snapshot of where we are with public safety over these last few months, the first 8 months of the year. I'd be glad to answer any other questions off the top of my head that you might have on different topics, if you do.
Are there any questions for Chief Kitchens on what he just briefed us on, fellow commissioners? Any questions on what we've just been briefed on? If not, I would like to return a little bit to last week, Chief Kitchens, which when you came and briefed us and we had an agenda item, the police department requesting the commission place an ordinance on first consideration that adopts the 2020 Uniform Public Offense Code for Kansas cities for use by the city of Leavenworth. And we had a pretty good discussion. Myself and fellow commissioners got a lot of cards and letters from our fellow citizens, met some of our fellow citizens in terms of concern that we were going to do something, giving the public county health officer some authority with respect to what authority only elected officials should have. So I thought, in the interest of just trying to clarify a few things with respect to the adoption of the Uniform Public Offense Code, or UPOC, that I would just kind of review a few things that I've researched over the last week with some help from staff, and then can get any comments from you or my fellow commissioners after I go through these points. The adoption of section 10.29, and that was the violation of a public health order. That's where we focused on last week. The adoption of that particular section, 10.29 of the UPOC, does not deal with the authority, power, or responsibilities of the Leavenworth County Health Officer in any way. The authority granted to the Leavenworth County Health Officer is granted by Kansas State Statute 65-119. The city of Leavenworth has no authority to grant power to the county health officer. KSA 65-119 provides the definition of authority for any county or joint board of health or local health officer. And Leavenworth County does have a local health officer, and his name is Mr. Jamie Miller, for anybody who's new to this particular subject. State statute already authorizes the county health officer to, quote, order any sheriff, deputy sheriff, or other law enforcement officer of the state or any subdivision to assist in the execution or enforcement of any order issued under this section. And I think that's the key thing about what we were looking at in terms of this adoption of the UPOC. It was giving us the tools, the wherewithal to enforce an order that the county public health officer would would promulgate based on the authority that he has by state statute. So it deals with enforcement. It doesn't deal with mandating masks or any other authority that we don't have as a city, but ties to what the county health officer can do based on the Kansas statutes. Additionally, state statute already gives the county health officer the power and authorization to, among other actions, prohibit public gatherings when necessary for the control of any and all infectious or contagious disease. He's got that authority. He hasn't, there's been recommendations, but he has not put it out in order, as far as I know, over the last 4 or 5 months to prohibit public gatherings or mask wearing or anything like that. The change in the UPOC simply gives a city the option to issue a citation for what the state has already authorized as binding law and as pertaining to the authorities of the county health officer. There is no requirement that the city issue a citation. The city has always favored an education and information approach to these types of situations, and a citation would be a last resort. KSA 65-202, which is another statute that impacts this particular subject, goes on to further explain the duties, oaths of office, and overall role of a local or county health officer. Chief among the duties prescribed in state law is for a local health officer to use all known measures to prevent the spread of any such infectious, contagious, or communicable disease, and shall perform such other duties as this act, his or her county or joint board of the Secretary of Health and Environment may require. So those are the points that I wanted to share, and I want to see if any of my commissioners wish to weigh in or have questions or comments on this particular, because next week it is going to come up for second consideration. We're not dealing with that. This is a study session this week, but it will come up for second consideration and a vote next week. Any commissioners wish to say anything?
Commissioner Preisinger, I just want to thank the mayor for outlining the background of the responsibilities of the county health officer and the powers vested in that county health officer by the state of Kansas. I imagine the Kansas State Legislature at some point gave the county, through some type of laws or action in the legislature, that they gave the county health officers that type of authority. And I don't think that happened in the last couple of weeks or in the last 6 months. I think they've always had that. There's other unelected people that have a lot of authority. I imagine Chuck McCaha, our emergency management coordinator for the county, in times of emergency, floods, tornadoes, whatever may occur at some time, he possibly has the authority to order certain things, and he might need the assistance of the PD or the Sheriff's Department to ensure that those orders are carried out. And I do believe the city of Lansing passed this. Do you know if they did or not, Mr. Kramer?
I believe they did.
Yeah, so that they passed it too. I don't know if there's much question out there, but I know that we're dealing with Leavenworth. So once again, I want to thank the mayor for giving a deep explanation of this, and obviously it'll be on the agenda for next week.
Okay, any commissioner, my fellow other commissioners, any comments or questions? Commissioner Wilson? Commissioner Wilson first.
I just wanted to say thank you, Mr. Mr. Mayor, for providing clarity with this in the history as well, too. Thank you.
Thank you, Mr. Commissioner Wilson. Commissioner Leonhard?
Yeah, Commissioner Leonhard, actually I was going to say the same thing, so thank you for the explanation.
Okay. Commissioner Bowder?
No, I don't have any additional questions or comments on this. Thank you.
Okay. And the comment about our Lansing is, I mean, it's a fact. I would, next week, just check with a few other cities if we could in Johnson County to see, because this has been something, Chief, that we've done every year, I don't know if it's been every year since you've been the chief, but it's something that comes up pretty routinely. I appreciate the transparency of, bringing the two issues, the UPOC as it relates to section 10.29 to our attention, just because it's important and it's on people's minds. And I appreciate the information we received, and I learned a lot over the last week in terms of researching it further. I did have a question. I think some other cities probably have, given it a thumbs up, and they're moving on to other things at this point. I would like to add, do you have any comments on the UPOC? Because I did have a question about the other subject area we touched on last week.
Just to reiterate what you said, Mr. Mayor, that this, I've been the chief for 13 years, every year for 13 years. I know Chief Doring did it every year for that. This is the 35th edition of the manual, and so it's not an uncommon issue. There are changes every year. We highlight those changes to make sure that you're comfortable with those or have any questions. So that's pretty routine.
Yeah, and this is something that comes as a recommendation from the League of Kansas Municipalities every year, correct?
Yes, sir.
Okay. So the other one was additionally, staff is recommending that we opt out and not include the following sections of the Uniform Public Offense Code for 2020. And a recent decision by the Kansas Court of Appeals ruled these types of offenses must be adjudicated in a court of record in order to satisfy the requirement of registration as a sexual offender, which I believe is a really, really important requirement. So just give us a little,
Sure.
It's self-explanatory, isn't it, in terms of what's been happening in the court system within the state?
Yes, sir. So what happened is there's a person in Johnson County that Shawnee, the city of Shawnee, that was convicted of an offense similar to this in their city court. And this person is trying every conceivable way to maneuver out of having to register as a sex offender. The Kansas Court of Appeals ruled that the provision of registering as a sex offender must be done in a court of record. Municipal court is not a court of record. District court is a court of record. Todd Thompson in the county attorney's office. And so the city attorney, Catalina Thompson, and Todd Thompson and I all collaborated to ensure that whatever it is that happens in that particular case doesn't happen again. We don't want somebody who commits a sex offense or a violent sex offense against a woman or a child to be able to create some loophole where they don't have to do it. We want them to be subject to the full provisions of the statute. And if that means that we prosecute them in district court, that's fine. That's perfectly fine. Ms. Catalina Thompson recognized that immediately. It was all over it. She talked to Mr. Thompson, who gladly agreed to accept it. It's a higher caseload for his office, but he understood exactly what we were trying to do. And, that's the principal point here, is that we're just not going to allow that. We're going to work very hard to make sure that people who commit these kinds of crimes are punished appropriately. And so that was our counter to that. Sure. And so that's what we were trying to do.
That's clear. Any questions or comments for Chief Kitchens on that particular aspect of what we were briefed on last week, and which will be part of what we will be under second consideration next week at our regular meeting?
Once again, thanks, Chief, for explaining that. For the public that is listening or watching tonight, we are not giving a pass to persons that commit sex crimes. I think that rumor got started that we were opting out of that. In fact, we're putting more teeth into people being charged with sex crimes on how they could be dealt with. We are not giving a pass on that. Thank you, Chief.
Yes, sir.
Any other questions or comments from fellow commissioners? Seeing none, thank you, Chief. We appreciate your update, very informative, and you have a good rest of your evening.
Thank you, sir.
We're going to go to the next agenda item, which is the Karazhak funding review and update. Mr. Kramer?
Mr. Mayor and Commission, thank you. I'll be brief with this item tonight. I wanted to give the Commission and the public a little update on the CARES Act funding that you've heard a little bit about. Just briefly on the background, the state of Kansas released approximately $19.2 million in federal CARES Act funding to Leavenworth County. Based on the population allocation, the city of Leavenworth is in line to receive about $6.75 million in CARES Act dollars. The use of those dollars is regulated by what was called the SPARK Committee. That's an acronym for supporting Kansas and getting institutions back and public health issues back on track. We have not received any of those funds as of this point. We have submitted reimbursement requests to the county. The county is continuing to work with the state, and once that is all worked out, I'm confident that we'll start seeing those funds. I just wanted to have a short conversation tonight about some of the ideas and planning and areas that we're looking at to use some of those funds. First of all, the state did provide guidance for 4 areas, and I think the first one is maybe the most important to keep in mind when we start talking in the next couple months about how we allocate these funds, whether at the city or in the public. The first one is to make public institutions whole. And what that means, I think, is the overriding goal is that local governments will not have to raise taxes on people struggling with COVID because of revenue shortfalls. So with this money, I believe, comes the responsibility to use it prudently so that we don't have to look at increasing our revenue to continue to provide police service and fire service and parks and recreation and roads. So what that means, I think, to the commission is sort of being diligent that we are being good stewards of those dollars as far as city services. Second one is protecting the health of Kansas. Obviously, this is a global health crisis, and so the state did provide guidance and provide direction that some health grants, some health programs, some health type activities were authorized and encouraged. And we have some of those in a draft plan that we have that I'll talk about in just a second. The next one is revitalizing local businesses. I think we've seen a lot of attention paid toward local businesses. There are certainly a lot of federal programs, maybe chief among the most or the highest profile, the Paycheck Protection Program, and other ones. We've done some local grants already with some community development block grant funds run out of Taylor Tedder's office. But we will have the opportunity, should the commission so choose, to also invest into local businesses. And then finally is building resilient communities. That is a little bit of a wide net, but it really focuses on supporting workforce, housing, childcare, social services, and other investments critical for the long-term and community growth. Those could be nonprofit grants and those type of activities. So very briefly, the city has submitted a spend plan to the county, for the full amount, $6.757 million. And we will continue to submit paid invoices or paid reimbursement requests with all supporting documentation to the county. And as those funds come to the city, I will notify the commission, and we will continue to look for ways to get those dollars either out into the community or into areas that safeguard the city against future revenue shortfalls. So what I wanted to just briefly talk about and get any feedback for the commission is that city staff will work to ensure that costs already incurred related to COVID, that's PPE, that's overtime, that's any costs that have already occurred, will be reimbursed first. And then we move to a fund or an amount that we believe is responsible to safeguard against future revenue shortfalls. And then finally, as we look toward the community of how we can help our residents, our businesses, our nonprofits, and our partners. So I wanted to touch on the 5 or 6 large silos that I had, and then look for any feedback from the commissions. So the first one that we've included is healthcare grants. These are grants for our healthcare providers, whether those be entities like St. Vincent Clinic and or other outlets for healthcare in the community. We've included that. That also includes potentially some mental health funding for those providers. As with Catholic Charities, rent and mortgage assistance and utility assistance and food pantry assistance, that is direct help to our citizens in Leavenworth who are in need, and so we've included that. We've included nonprofits, so these are the organizations that maybe have not seen the donations that they've seen before. They have increased operating costs, they have PPE costs of their own, they have new needs, as we heard from Catholic Charity, a new clientele, a new group of users needing that, and they have great demand there. And then finally, public information is another outlet that we've really identified, that we want to make sure that if we do give these organizations these funds, that we communicate to all residents, not just the ones who have used them in the past, but everybody who may be in assistance about where they can get help. Additionally, we have some ideas regarding health and sanitation around the city, hand washing stations, upgrades to our restrooms, upgrades to some of our city facilities. And then we are looking at ways to facilitate more seamless virtual meetings that we can ensure social distancing in public safety. So I really wanted to focus on the stuff outside the city hall building and this city reimbursable grants, and get any feedback from the commission about where they'd like to see some attention given into the community.
Any comments or questions or suggestions for the city manager on what he's just briefed us on?
I have something.
Okay, Commissioner Bowder?
Yeah, when you talk about healthcare, I'm gonna bring up something, but this is nothing to do with the transportation plan, but the Cushing Hospital Foundation. One of the big things that they provided for Cushing patients, this was before COVID, before anything else, was transportation into the city. I mean, just emergency transportation. I mean, not like emergency, but like to go to the doctor or something like this from the hospital, or related to, you know, to that. So following afterwards, like going to rehab and things like that. So as you're thinking about health, you might think about what we're losing and maybe helping with some of the replacement of that as we go through this time.
Okay.
Thank you, Commissioner Bowder. That's a very, very good point. Any other questions or comments for the city manager on this particular agenda item, Karazhak funding review and update? I have a question, Mr. Kramer, about, so just tell us a little bit about the process. Obviously, I don't think we've gotten any of the funds yet for these requirements that we've laid out. Just talk a little bit about the process and you probably don't know everything that you'd like to know, but just give us a little feedback on the timeline and the process of how this is going to work.
So our understanding is that the first thing we have to start with are eligible activities, and then we have to submit either invoices or records indicating that we've used those funds for eligible expenses. So to date, the city has submitted about $4.9 million in documentation and reimbursement requests to the county. There's a specific form that we are required to use, plus backup documentation, whether that's individual receipts, which I believe we had well over 100 receipts that we submitted dealing with masks and everything that police and fire and parks and city employees used to combat COVID, as well as payroll numbers for our public safety employees. So we submit that to the county. The county has set up a review team that went through some training, and they make a determination on eligibility, and then they process that through their accounts payable office and then submit that funds to the city. So I believe the holdup right now is we've submitted our first set. The county is still working with the state on some final approvals of their processes, and once those have been worked out, we should start seeing those funds.
Do you think we'll start seeing some funds in 2020?
I believe so. I believe I'm led to believe, potentially in the next couple of weeks.
Okay.
Yep.
Okay, that's helpful. And I would say that, what'd you say, 4.9 million?
4.9
out of the
thus far.
6.7, that's really, that's a high percentage in terms of having all the receipts and the requirements and the receipts to back up those requirements. So that's a very, very good kudos to you and the staff, Ruby and the finance staff and the rest of the city staff as far as being on top of that, because that's a very, very good percentage of what the final allocation is going to be as far as funds coming to the city. Any other questions or comments for the city manager on Karazhak funding review and update?
Mr. Mayor, Mr. Kramer, there's 15 million being allocated, 15 million and some change to the county. Are those funds in the county's coffers right now? Do you know?
I don't know for sure.
Okay.
I believe yes, but I don't know for sure.
And then when you submit, we are allocated 6.7 million, obviously we have to submit. Who's the arbitrator? Who decides, we'll pay that one, no, we won't pay that one?
I believe the county has a committee that I believe has 2 commissioners and some staff on that, so that they did review our spend plan and did approve our spend plan. So there
Okay.
shouldn't be any question to the eligibility of our reimbursements, because the spend plan outlining those reimbursements or those activities has already been approved.
Okay, so they're not gonna have necessarily line item veto or,
I don't believe so.
okay, so,
That's a good question.
okay, thank you.
I do want to point out that the county ultimately is responsible to the state, even for the city's payment, so
Sure.
diligence on their part is warranted, but
I understand.
hopefully everything we turn in, meets the requirements.
Okay, thank you.
I don't think we have any other further questions. I don't see any of our commissioners out in remote land wanting to ask any questions, so I think that's a good rundown. Thank you, Mr. Kramer.
Yep.
Thank you to the staff. The next, first consider, I'm sorry? Someone have?
I'm
Okay.
sorry. I was just saying great job to the
Oh,
staff.
yeah.
Thank you.
Absolutely. We have to go into a special meeting now, and so I will entertain a motion for a special meeting. This is gonna be on first consideration ordinance condemnation of related to 16th Terrace and Thornton Phase 2 and Phase 3 drainage project. But I'll entertain a motion on opening a special meeting.
So moved.
Can I get a
Second,
okay.
Commissioner Bowder.
There's a motion and a second to open a special meeting. We're going to begin voting with Commissioner Wilson. Commissioner Leonhard.
Aye.
Commissioner Bowder.
Aye.
Commissioner Preisinger.
Aye.
And I, as the mayor, vote aye. The ayes have it, 5-0. Motion carries. So we are now in a special meeting to discuss first consideration ordinance condemnation connected with 16th Terrace and Thornton Phases 2 and 3 drainage project.
Mr. Mayor and Commissioner, I'm going to turn this item over to our Public Works Director, Mike McDonald.
Okay. Hello, Mr. McDonald. How are you doing tonight?
Good evening, sir and commissioners. We're asking you this evening to take the next step forward toward acquiring the necessary easements for the drainage project. This is repairs or improvements, if you will, to the creek behind 16th Terrace houses. It is a continuation of some work that we have been working on the last few years, and it's in 2 phases to address erosion and property degradation in the creek alignment. There are 2 phases upcoming on the project, which will complete improvements down to Viola Street. We have completed plans, and we have been working to contact property owners for easements. We have contacted them multiple times with city staff, and we have also secured the services of John Amrine of the land company to further communicate with them to see if he can facilitate property owners providing us easements. There are 13 properties that we need easements from. I believe the first 6 of them are what I would call phase 2, and then the second group of 7 is phase 3. While we have contacted all of them, we have been focusing on the phase 2 properties with John Amrine's efforts, since that is the first phase of the next portion of the project. Ultimately, we requested the City Commission adopt a resolution which identified the need for the project and the possibility that we would exercise eminent domain, or what is known generally by others as condemnation, to acquire the necessary easements. We have prepared legal descriptions for the various tracts. We have reviewed this with the City Clerk's office and our City Attorney, and we request that the ordinance before you this evening be placed on first consideration so that we can move forward toward, we have scheduled, I believe, a second consideration for the next regular meeting with the City Commission. At that point, we will file these actions in the district court, and the judge takes it over from there. Essentially, appoints a series of court-appointed appraisers, holds a hearing where the city and the property owners involved can discuss or state their views on the matter. The appraisers provide a report to the judge, and he issues his findings. And the city then has a choice to agree with the judge's decision and pay the money, in which case you can move forward with the project or with the easement. Or if you choose not to agree with the judge, then you do not receive the easement. Likewise, our property owners at that point have options as well. Essentially, their option is to proceed to another court action, disagreeing with the amount of the settlement rather than the necessity of the settlement. But that's in the future. We very rarely get to those points where we're actually having to pay money for properties. It does happen, but we believe that by continuing to move forward, we can equitably resolve issues with the property owners that you see in the policy report this evening.
Okay. Questions or comments for Mr. McDonald? Commissioner Preisinger?
Mr. McDonald, there's 13 property owners, of which 12 of them are getting just require a temporary construction easement. That means that you need to occupy their property for a bit of time while you do whatever digging you're doing, or for equipment, or for deployment of equipment or something like that. Am I correct in that assumption?
Yeah, that is correct, sir.
And do property owners get some money for having a TCE, a temporary construction easement, or just that the promise that their property will be replaced to the same condition it was before you moved on it?
Well, each property is unique, and we may considerably change the way that the property involved in the temporary construction easement actually looks at the end of the day. We discuss with individual property owners. Some have sheds, some have trees, some have fencing, some have a need for secure fencing during the project. Others simply want their fencing replaced at the end of the project. Some of these issues we can incorporate into the construction of the project. Oftentimes, if someone has a need for fencing, we will reach a financial agreement where we will pay them with city funds for the cost for them to fix their fencing, should they choose to do so at the conclusion of the project. But we do talk each property with each property owner and their individual needs and expectations.
Okay, and these 13 property owners, are these the ones that through negotiations thus far you've not been able to come to an agreement, and that's why we're taking it to this level?
That is correct. There are at least two on this list that we believe we will reach an agreement with within the next week to 10 days. However, we've thought that for the last 2 weeks as well.
Okay.
So if we will continue to negotiate and meet with property owners through city staff or with John Amrine to reach fair agreements for those that want this project to move forward.
Okay, thank you.
And there's only, at all those properties, there's only one permanent drainage easement. Only one of those properties requires that, correct, Mr. McDonald?
Yes, I believe there is one of the properties that we have not acquired permission is a permanent drainage easement. There are other properties that we have reached agreement with the owners on that are permanent drainage easements.
That's good to know. That's good. I didn't know that, but that's a good point. Any other comments or questions from fellow commissioners to Mr. McDonald on this particular agenda item? Seeing none, now this is first consideration, so we just need a consensus, correct?
That's correct.
And so what we're asking a consensus on is a consensus, putting it on first consideration so we can proceed to sometime in the not too distant future, coming up for second consideration where we'll have, the formal motion, but we need a consensus on this ordinance which necessitates the appropriation of private property by condemnation. But what we're talking about are these temporary construction easements that are necessary, and then this one permanent drainage easement for the 16th Terrace and Thornton Phase 2 and 3 drainage project. So I'm going to go, and I'll start with Commissioner Wilson. Are you in favor of this first consideration on this agenda item?
Yes.
Okay, Commissioner Leonhard,
Yes.
Commissioner Bowder.
Yes.
Okay, that's 3, which means we have a consensus, so we're good on first consideration. And we will see this in, like I said, the not too distant future at probably a normal regular meeting for second consideration and approval by, of this ordinance by the City Commission. Any other questions or comments on this particular agenda item? If not, we're going to go around the horn because we don't have to close the special meeting. I don't think we will eventually get to adjournment, but we don't have to close it. So I'm going to start with Commissioner Wilson as far as any comments or at the end of our meeting here.
Yes, I would like to invite everyone to the United as One 3-day church revival. That'll be coming up this upcoming Thursday, Friday, and Saturday from 6:30 to 8:30. There's a total of 13 churches coming together to spread the love of Christ and bring unity in our city.
Great.
And the location is at 4th and Chestnut, the old space where East Middle School used to be at, right next to First United Methodist Church.
And people just need to bring something to sit on, basically, or is that what they need, like a little lawn chair or something like that?
Yes, sir. Thank you for that. Yes, and they would need to bring their own lawn chair as well, too.
Okay, probably some water or something so you don't get dehydrated, but the weather's been...
We'll be providing water.
Okay, good.
Yeah.
Good deal. Anything else, Commissioner Wilson?
Yes, and I had a few citizens reaching out to me inquiring about the Thornton Street project. If we could provide an update on that, that'd be great.
You want that quick update right now, or are you looking for another time, or just for a quick, Mr. McDonald's here. Can we get a quick update, Mr. McDonald?
He got the answers, I know he do.
Mr. Mayor and Commissioners, Thornton Street project, they are expected to put asphalt down this week, at which point they will put the curbing on top of the first layer of asphalt. And after that, they will work on the second layer of asphalt and then the sidewalks. They believe with anything resembling reasonable fall weather that they will be done by hopefully by the end of September or close to it, certainly by the end of October. It should be open this winter.
Thank you, appreciate it.
Anything else, Commissioner Wilson? No. And I would like to say, because the city manager sent out to the commissioners earlier today in an email, just a list of all the projects that are going to be started beginning today, I believe, 2020 pavement management program, which the list is right here. It looks really good, and we're looking forward to this work. Been a lot of great planning that's gone into it, and that's just an FYI for our citizens. And we're looking forward to that, and as I said, I believe it began today. Commissioner Leonhard, anything?
No, I have nothing at this time.
Okay, thank you. Commissioner Bowder?
No, I don't have anything this week either. Thank you so much.
Okay, thank you. Commissioner Preisinger?
I have nothing.
Okay, I just have two quick things. City Connection Bulletin, will that be coming out soon? That, the bulletin we put, normally I think it comes in September, doesn't it?
Yeah, I'll get you a mail date, I'm not sure.
Okay, I just wondered,
I think it's soon, we've already proofed everything, so.
yeah.
in the
Yeah,
next-
I didn't mean to surprise you, but I was just wondering about that, today as I, finished my preparation for the meeting. And then, I think Leavenworth is going well, and, I think we had to postpone the sidewalk, art contest from last week till today, but generally, Mr. Kramer or Mr. Tedder, how do you think it's going?
Yeah, Mr. Mayor, I'd love to talk briefly. I was down there tonight. I took my family to the s'mores night in Landing Park, and I think the sidewalk chalk art contest worked great, moving it to tonight. We got to walk up and down as we finished our s'mores. The participation has been good. It finishes this weekend with the drive-in movie, which sold out almost immediately. Maybe something we'll look at doing after Leavenworth, these community movie nights. So that's been going really well. The T-shirt pickup went well with Community America as our partner on that. So, and the mural was almost finished by the time I left the park tonight. So a lot of stuff going on with Leavenworth. It was a good crowd down there tonight.
Good, thank you for that update. I think it is going very, very well, and I'm very happy and appreciate all the work that Mr. Tedder has done and the staff here and the city staff that have helped him, but also O'Neill Events and Marketing. As usual, like they did last year, they're doing a bang-up job. So thank you to Kelly and her team. Since it's Ms. Williamson, since it's a study session, I don't need a motion for adjournment.
No, we're in a meeting now, we do need.
That's right. She told me that, I didn't listen to her. Okay, I'll entertain a motion for adjournment.
So moved.
Second?
Second.
Okay, all right. There's a motion and a second to adjourn tonight's special meeting. So we're gonna go around the horn and we're gonna begin with Commissioner Wilson.
Aye.
Commissioner Leonhard.
Aye.
Commissioner Bowder.
Aye.
Commissioner Preisinger.
Aye.
And I, as the mayor, vote ayes. The ayes have it. Vote is 5-0. So we are adjourned.